Thanks for coming. I'm Sean Krakiwsky. I'm the founder and CEO of Nanalysis Scientific Corp. We make portable MRI machines for healthcare and industrial applications. So I founded this company many years ago with a vision to disrupt the MRI space and make it work the way we think it should work. So for example, anybody in this room here should be able to make an appointment at their local pharmacy, sit down in a nice chair, have an MRI of their prostate or their ovaries, should be driven by AI, connected to the cloud, accessed through a trusted service like WebMD. And you should get a pleasant message saying something like, nothing wrong with your prostate, no need to consult your doctor at this time. Please consider doing this again 1 year from now. Or if you're playing football on a high school on Friday night in West Texas and you get your bell rung, as they used to say, you should just be able to go into your sporting facility, have an MRI of your brain, and determine conclusively, immediately, if you've had a concussion or not. So those are sort of examples of how we think MRI should work, rather than being sort of some exotic machine that's in specialized rooms that you have to wait to get access to, and sometimes beg your doctor to go get an MRI if you have a problem with your heel or your finger or something, and the doctor asks you silly questions like, is the fact that you can't walk on your heel affecting your life or whatever, So that's the way we think it should work. That's our grand vision that we have. And then we have a sort of very specific strategy to deal with some of the go-to-market challenges that you face when there's a cartel in place like GE, Siemens, and Philips that basically controls 100% of the global MRI market. So there's a few sort of strategic items that I need to touch upon as we go through this to explain how we're going to succeed with this grand challenge that we have. So we're experiencing tremendous year-over-year growth. We are a category-creating company in terms of portable MRI. And then also just recently, as is consistent with my vision when I founded the company, we're making service a critical part of our overall operating business, because in order to be able to achieve what we want to achieve, we have to have service capabilities in every major market in the world. So as we move towards our fantastic vision, our mission is to build a solid business around what I refer to as the unregulated part of this market opportunity. So the one that everybody would be familiar with that I just alluded to is a highly regulated healthcare opportunity. But there are unregulated opportunities that will allow us to get our revenue towards $100 million per year and build up some heft in our business, again, as we tackle some of the go-to-market challenges that we face. Experienced management team, just a fabulous CTO who has a real unique vision for the future of magnetic resonance. Where we're trading at today, we have a market cap of about 50 million. Our 2022 revenue was 25 million, and we are experiencing strong year-over-year growth. Senior independent board of directors. So this is a slide that I show just to kind of get calibrated on the language that I'm using so that we can all understand each other. So there's part of this story that sort of everybody will get, the part of these large MRI machines in hospitals that are used on human beings. But this type of technology is also used for industrial applications. In a lot of cases, they're very similar in that they're very large superconducting magnets that require the same liquid helium to keep those superconducting magnets cool. On this picture here on this slide, what I've depicted there is when one of these machines is used at a large pharma company or food company or petrochemical company. The gentlemen at the top of that scaffolding are inserting a standard 7-inch, 5-millimeter diameter test tube, and it's being put in the center of that magnet, and it's being imaged just like an MRI machine would image your knee or whatever. And so that technique of using MRI for industrial analysis has proven itself to be the gold standard of analysis in industry. The reason why it hasn't been widely adopted is because, again, the huge size, complexity, cost, being in specialized rooms with reinforced floors. So what our company has done is we've miniaturized this technology. We're democratizing it. We're building a real business on the unregulated part of the opportunity. We do have real revenue in the medical imaging side of the business right now. It's not the majority of our revenue. And then we have a specific strategy to one day have an FDA-approved product to go after the human medical imaging side of this business. So that's sort of what we do. Here's a look at our current product portfolio. So the products on the top left are portable MRI machines that are used by pharma companies, food companies. We've sold well over 1,000 of these units. And they're the full magnetic resonance system. In other words, the miniaturized magnet, the electronics, and the end user software. The product on the top right is in fact a medical imaging product, but as you can probably determine from the picture, it's not the full system. It's only the electronics and software, the same electronics and software that's in all of our products. So we're building a common technology platform. And then it doesn't have the magnet. In other words, for those medical imaging applications that we generate revenue from right now, we'll source the magnet from third parties, and we're working on that technology with partners. We also have a full suite of accessories that go with our products. And then the relatively new thing, at least in terms of its sort of size, is service. So, I want to be able to service an MRI machine in a hospital in Menlo Park, California, or a corn processing facility in rural Mississippi. So service has become a big part of it. About a year ago, we had a huge contract win that I'm going to sort of highlight because right now it sort of represents a disproportionately large part of our business. All the technology is proprietary, developed in-house in terms of the core IP, but also in terms of the tech platform and also manufacturing. So manufacturing is a key part of our vision as well. When I started this business, I went to our shareholders who still support the company after over a decade, and I said, I don't want to do all this awesome innovation and then as soon as we're successful have it ripped off in China or India. So we invested, even before we had a commercially viable product, in proprietary manufacturing processes. And if you visited our facility in Calgary, you would see about a dozen proprietary processes. And the fruit of those are that if you took our product apart in China and you had 10 PhDs that were smart enough to understand our patents, you still wouldn't be able to reverse engineer the technology unless you knew exactly what we were doing in our manufacturing facility. So yeah, important for IP considerations, but also quality and profit margin considerations as well. So many granted patents and also an exciting patent pipeline as well. So this is a slide I call the appification of magnetic resonance, and it's an important growth driver for you, and it just sort of gives you a glimpse into the type of innovation that we do ourselves and also with partners. So if you have a PhD in chemistry or chemical engineering, or if you're a radiologist, you'll be able to analyze, interpret the data on the left and indeed take action on it. But our customers and our partners are telling us that they want the data to look more like the data on the right. In other words, simple answers to questions. For example, we have customers in the mining industry who use our products, and they just want one number, and that's % lithium in their brine pools. Right? And so in those types of cases, we write a little app, and rather than showing a complicated type of output like that, we just show their technicians one number. When they put the test tube in the machine, it just says 13% lithium in this brine pool, or whatever the case may be. Actually, that percentage would be more like what a cannabis customer would see when they're looking for THC or CBD. But also looking at suspicious white powders. We have partner in Germany with the federal police force, and they're analyzing suspicious white powders, just to see is there fentanyl in this, or even sort of more interestingly are there synthetic opioids in the suspicious white powder? So you probably are thinking out there by now, well, there's many different types of ways to measure different things, analyze different things. Well, magnetic resonance is the best way. One reason why it's the best way is you could see a molecule that is a synthetic opioid that a clever chemist just tweaked, and it might not be on a forbidden identified list as of yet, but it's an opioid, right? And magnetic resonance can give you that information. Wet chemistry techniques and things like Raman spectroscopy and so on can't do that for you. So one of the many strengths of a magnetic resonance, in addition to it being non-destructive. In other words, you can measure the same sample over and over and over again, just like you can image the knee over and over again without there being a dose involved, like in an X-ray, for example. So with the simple applications, we do this ourselves, and then more complicated applications, we work with partners on what I call the amplification of magnetic resonance. So we're in the scientific instrumentation space or the test and measurement space. It's a huge and growing global market opportunity. You know, when I founded this company, this was sort of a boring space, but COVID kind of made test and measurement equipment kind of sexy. So we're really happy to be in this space right now. You know, everybody knows what a PCR test is now, or who Thermo Scientific is, and so on. So it's a great place to be. We feel like you know, with ongoing miniaturization and democratization, especially with regards to how people interpret the data, our total addressable market, which we think is around $4 billion right now per year, is going to continue to increase in this larger market opportunity. We sell to the largest companies in the world like BASF and Eli Lilly, but we also sell to two-person little biotech companies. We sell to the most famous universities like Oxford Instruments has 10 of our, Oxford University has 10 of our machines, for example, but we'll also sell to tiny little community colleges in places like rural India. And by the way, in those types of markets, there are no liquid helium trucks driving around to keep superconducting magnets cool. So the, you know, the democratization theme and that with that particular illusion is regard to no need for liquid helium and liquid nitrogen to cool the magnets and so on. We also sell to government labs all over the world. In the United States and Canada, and also evolving in France and Germany and Switzerland, we sell direct. We have a huge sales organization that we've just launched through an acquisition about a year ago. And then in international markets, we sell through local dealers, like whether it's India, Indonesia, Chile, we'll sell through local dealers that are selling complementary products and services. And my vision is to go direct, not just for sales, but as I've mentioned a few times, for service in every major market in the world going forward. We're also working on several sort of value-added distribution deals where you know, large established companies will take our products, rebrand them possibly, where we maintain ingredient branding, and they'll go deep in certain verticals like the food vertical or food and beverage. So we have a lot of exciting partnerships along those lines to drive growth going forward. Just a little bit of our history, you know. So I mentioned we started the company from scratch. We did all the things that you'd expect a tech company to do in terms of the IP, the tech platform, the products, the manufacturing, the marketing, the sales, and so on. In 2019, we went public. We did an RTO with CPC, and specifically our strategy then was to do acquisitions. So it's been a very tumultuous last sort of 3.5 years or so. You know, we went through COVID. We've done 4 acquisitions during that time and been digesting them. I want to emphasize that our acquisition strategy, first of all, our acquisition strategy is on pause right now, you know, until we feel like we're fairly valued. But it's not a roll-up, so it's not just, you know, consolidating like similar companies and reducing costs. It's strategic. So, you know, one company we bought was electronics and software that had a lot of exposure to new MRI technologies. Another company we bought was pure sales and service of scientific equipment. So you know, we're bolting on different businesses to get to critical mass faster than we could do organically. And then I have intentions to continue that again once all of our key stakeholders say, okay, it's time to put the pedal to the metal again. Right now, we're digesting what we've done, and we've just done some really exciting things in terms of our top line and positioning us for profitability. We're gonna sort of operate in that mode for a couple of years, and then we're gonna resume acquisitions again. So sort of the last part of this presentation is just to highlight an event that occurred to us approximately a year ago. And it has to do with our strategy of having service in every major market in the world. So So I've talked about, our grand vision of disrupting the MRI space. I've talked about building a solid business with revenue and profitability around the unregulated part of the opportunity before we go after some of the go-to-market challenges in the healthcare industry. And part of all that is being able to service our equipment globally and control our own destiny. So I'm a third-time entrepreneur. By education, I have a master's degree in electrical engineering, but really professionally, I'm a tech entrepreneur. And one of the things that I've learned from past experiences is that if you can, it's better to control your own destiny. And when you have like a B2B industrial tech kind of business like us, service is a critical part of that. So a year ago, we won what the headlines are of it anyways is $160 million contract to service scientific equipment in Canadian airports, like imaging equipment of different kind. Also those little swab testers where they're basically looking for explosives when they swab your computer that, has this guy been working with nitrogen in the last sort of week or something like that. So the headline number is a $160 million contract in 5 years. We think we can operate that at 30% EBITDA margins. We're almost at profitability right now on that, just on that profit alone. But the fine print on that project is that it's a 15-year, $480 million contract. There's 2 renewal terms. And so if you run any kind of an NPV on that, regardless of what discount rate you use, and it is indexed to inflation, by the way, so those dollar numbers are real dollars that are relevant to today. And so we think it's just a tremendous asset. It's not something that I expected we were going to do when we made a particular acquisition in June of 2022. But a few months after we closed that acquisition, it became apparent that we were going to win this contract. And so strategically, it's a way for us to fund our global service organization. And, don't be surprised if one day there aren't portable MRI machines in airports and border crossings and so on that are analyzing suspicious white powders and liquids and that sort of thing. So very proud of that. As you can imagine, it was a huge undertaking for our company. We began building up the resources on that and working with the customer in June of 2022. So just at it for over a year now. Our last month's billing was over $1 million. And where we're going to get to is we'll be billing $2.5 million or more per month. And again, we expect to be doing that for 15 years. And again, we think we can do, our CFO probably wouldn't say this, but I'll say it. I think we can do between 30 and 40% EBITDA margins. Just to sort of a little bit of evidence in that direction is that a typical cost for us is about $30 per hour for one of our field techs that operate in this environment, and we build them out for $300 per hour. The customer, again, if you haven't heard of CATSA before, it's the Canadian version of the TSA. So basically, this contract is with the government of Canada. Rock solid and super sticky. We're an essential service, and we're just really ecstatic about the progress that we've made in the short time. And on this project, we're on the cusp of being cash flow positive. And we're also on the cusp of being cash flow positive in our business as a whole. So just a little bit of a highlight of one specific asset in our company that's sort of more recent in nature. And with that, I'd like to end the presentation just by emphasizing how fabulous our people are. We have offices in Phoenix and Strasbourg and Zurich, and our headquarters is in Calgary. I'm a Calgary boy. People say, why is it in Calgary? Because I'm a Calgary boy. And so that's where I've started my businesses in the past, and that's where we're headquartered today. So I'm happy to answer any questions that anybody might have about any aspect of our business. Yes, sir. Correct. That's correct. We don't have any revenue for that right now, but that is the plan. That is indeed the plan. I also want to mention that the workforce that we've deployed, so we've successfully staffed it. So there's no more hirings that need to occur. And at full deployment or full operational capability, those workers are being used at about a 50% utilization rate. So they're also available to work on other things, to service other pieces of equipment, like our magnetic resonance machines. Our customer is very happy with our service, and they're also referring us to new contract opportunities that are sort of this genre. But yeah, that is the plan, is to sell them on our proprietary products. But right now, it's servicing third-party equipment. Short answer is no. You know, right now we're not making that particular type of imaging equipment. But we do, one of the reasons why we won the contract is because we do have the capability to take these machines apart, fully understand them, and fix certain aspects of them. And so the customer really liked the fact that we're a real tech company and not just sort of a, you know, like a service organization that really doesn't understand what the technology is. Our customer, you know, tends to get maybe not treated entirely fairly by the OEM manufacturers. You know, they'll make certain claims about what's required or what's not, and the customer doesn't know, but we know. So that's a big reason why we won this contract. Yeah. So we recently got a credit facility from ATB that consists of a $10 million term loan, a $5 million standard operating line, and then there's an additional $5 million accordion line that we probably will never use, but it's there. So approximately we've used about $7 million of the $10 million term loan. We've used 0 of the operating line. And I want to just emphasize the specific reason why we needed that credit facility and why we got it was because of this particular contract. So it was to fund this particular contract. We didn't need any debt for the other part of our business, which, like I mentioned, did $25 million in revenue in 2022. This contract was not part of that revenue at all. So today, no, but that is the plan. So this contract itself, I believe, will fund activity for many years to come, such that we don't have to do anything dilutive going forward. That's why I signed the contract. People say, you know, some people in this room say, you know, stick to your knitting. Why did you sign this contract? Well, I'm an entrepreneur, and I don't know about you, but whenever there's an opportunity to sign a $480 million contract with the government of Canada, I'm going to figure out a way to make it work. And, you know, you can probably think about some things we could do with this asset as well that I'm not going to mention right now, but, you know, it's worth money. However that manifests itself next year or the year after, right? So that's why I signed the contract. Okay, well, thank you very much for listening to my presentation today. I really appreciate it, and I look forward to talking to anybody offline here. Thank you.